Hi, I'm Dr. Lucy Meier from Third Coast Foot and Ankle, and I'm going to discuss with you a little bit about regenerative medicine. What is it and why are we using it? Now, the regenerative medicine, the focus of it is really to repair, replace, or regenerate our body's natural cells, tissues, and organs. This can be done in a lot of different ways, but the focus of regenerative medicine is actually harnessing our body's own natural capabilities to allow for healing, repair, and regeneration. So it's a really cool part of medicine because we're not necessarily introducing like foreign ideas. We're just trying to manipulate the body to kind of like be its best self when we're undergoing an injury or a disease. So this means that it's also affecting like every different type of medicine. So oncology, cancer therapies, when we think about stem cell replacement and bone marrow transplants, these are all different types of regenerative medicine. We see it also in ophthalmology in the eyes, where we're seeing regeneration of different types of tissues, macular degeneration, and all of these different treatments revolving some of those diseases. So it is an ever evolving type of medicine that is very well established now in kind of mainstream medicine. The fact that it's well established doesn't necessarily always mean that it's implemented broadly across every single different area. And that's because it is a new type of medicine in the sense that we don't have the 10, 20-year follow-ups to really understand that long-term efficacy of these treatments. They're very well documented to be safe and effective. It's just how long will they be safe and effective for over that extended period of time. Now, in our practice, we utilize regenerative medicine in a lot of different ways, and mostly focusing on tissue regeneration. There's some wound care for like diabetic foot wounds that we can really tap into this technology for, but more so focused into chronic plantar fasciitis or Achilles tendinosis, and utilizing these treatments once again to harness your body's own natural capabilities to go through that healing process. So we're not doing things overly invasive or introducing new materials or new drugs to help your body heal. Now, because that regenerative medicine is kind of this ever-evolving thing, it also means that there's always like new shiny objects on the market. And so we like to really focus on those treatments that give you really like persistent or well-proven, I should say, results. So things like shockwave therapy and PRP is something that we utilize in our office, but we love to coordinate them with even more evolving treatments like laser therapy that can really counterbalance or really maximize the effects of these regenerative medicine treatments. Now, the one thing to be really focused on when you're looking at incorporating regenerative medicine into your medical care is understanding whether or not the facility provides it. So not all facilities provide all levels of regenerative medicine because they're not always covered by insurance. And a lot of this has to do with it being newer technology and not having those long-term outcome studies that they're oftentimes looking for. The second part of it is that the training that goes into performing some of these procedures is a little bit more evolved, and it's not necessarily something that everybody is trained in and takes some extra or additional work from the provider. So always make sure that you're reaching out to an establishment that either is regularly offering regenerative medicine and has a trained personnel there who know how to perform it and understand kind of the medicine and technology behind it, because these protocols can need to be adjusted depending on the specific patient. So I hope this answers the question of kind of like that big overview idea of like what is regenerative medicine. We're going to see it a lot. This is the way medicine is going. It is going to be our future. And so I am excited to continue to educate you on all your different options. Now, if you are looking for regenerative medicine in your foot and ankle, please feel free to reach out to us. Also check out our other videos. We have lots of information online. If this video is helpful, please hit the like button. That really helps us. Once again, I am Dr. Lucy Meier from Third Coast Foot and Ankle.